name is Dr. LeishTon once again. I'm the president and CEO of LeishTon Consulting and Board Gov Limited, and the director for the LeishTon Center for Leadership and Governance Thinking. I'm here again to talk to you about COVID-19, which is a series. We've been doing a series with regard to educating, Nigerians and those across the globe on what they should look out for, how they should take care of themselves with regard to COVID-19. And it was born out of the fact that we had people calling us, including my mom, trying to know more about COVID-19. And we felt that it was very necessary for us to share our perspective on COVID-19. And so in our first video, we spoke about what COVID-19 is. What is coronavirus? And this novel coronavirus COVID-19, what is it all about? We talk about the symptoms of COVID-19. We also spoke about how is COVID-19 transmitted. We went again to talk about what is the concept of community spread. What is community spread and what is it all about? What do we need to do to actually curb community spread? And then we talk about what are some of the actions we need to, what are some of the things we need to do to prevent or to ensure that we don't contact COVID-19. And so right in this video, we'll be talking about actions that we need to take going forward as individuals, as a country, Nigeria, as a state, Lagos State, and every other state, probably the 36 states, including the FCT in Nigeria. And people across the globe can also learn from some of this action. And I think number one in that action is what they call, we must engage from the federal government, from the Center for Disease Control, from the state, from the local government in ongoing communication. We can't overemphasize that. We need to let the people know what COVID-19 is, what the novel coronavirus is. We must update them in terms of what is the impact, the negative, the ravaging impact it has got is had on the world, from the economic side, from the health side, and every other perspective that we must let the people know that it's a dangerous and destructive pandemic disease. And the next one is that we must restrict crowd size. I give kudos to Lagos State, who has been vigorously, out there to really enforce its crowd size enforcement with regard to not more than 50 people in crowd. And I noticed that even personally for faith-based organizations and my own church on Sunday, I joined the service via Instagram, and so it was a wonderful experience. And so it is very important for us to know that at this time we cannot hold weddings. At this time, people mustn't go to the gym, to the football field. It is very important. It is very serious. We must take this very seriously. Particularly the younger ones, they should not take this as a child's play. COVID-19 is a ravaging disease. It is ravaging the world. In the last count, you have more than 300,000 cases have been established, and over 90,000 deaths. And so the next one is we must practice social distancing. No handshake, no chop knuckle, what we normally call chop knuckle in Nigeria, with do like this, no chop knuckle. And for the part of the world where you normally hug, no more hugging. We must stay at home if we are told by our employers to stay at home, and if there are any stay-at-home order by any arm of the government, whether local government, state government, federal government, from the Nigerian Center for Disease Control, we must adhere to those guidelines, those rules, those protocols, and we must adhere to them. We must speak to our children. We must educate our aged mothers, our aged parents, our father, our grandparents. They must understand that they are very, very much at risk, particularly those parents that are 65 years old and above. And so it is very critical. The next one is that we must manage emotional well-being at this time. Emotional well-being, people must know that, because when people self-isolate, or if people are told to stay home, there are a lot of things. And so government must begin to also talk to the people what they need to do in their homes and in their respective places where they are self-isolating. It's very, very very, very important. And then specifically, I would say that We must also ensure that whenever we experience any of the symptoms, with regard to fever, with regard to cough, shortness of breath, we call our, what you call our doctors immediately. If we don't have any doctor, you must also speak directly to any of the lines or contact the Nigerian Center for Disease Control. It is very critical that we do that before it becomes too late. And we must also ensure that there are travel restrictions, and the travel restriction, it's a very good news right now that Nigeria has also closed its air, is a sea and land border. And so we must also ensure that even within the Nigeria space, that even interstate, interlocal government travel, that we make certain pronouncement with regard to restrictions, and with regard to transportation, the number of passengers in our buses, particularly in Lagos in BRT, that there is proper monitoring to ensure that there is no overcrowding in those BRT buses. And I hope that we are able to stay safe, we are able to adhere strictly. And sometimes the young people believe that they are invisible and that they are immune. They are not immune. And even if you are immune, remember, never forget that you have your aged parents at home, and you have your loved ones, you have your parents, even some of your siblings. They might have some underlying conditions like that, they might be diabetic, those of them that have liver, that have lungs problem. So remember, if they don't have a very effective system, immune system to fight COVID-19, you might lose your loved ones. And I don't want you to lose your loved ones. And I don't want to lose my loved ones. And I want all Nigerians to overcome COVID-19, to get to the other side when we are able to overcome this storm, and together we shall triumph over COVID-19. Thank you very much. And before I go, I would say I'm not a medical doctor, I'm an academic doctor, and it's very important for you to know that. But I believe that based on what I'm hearing, it is my responsibility to also share what I know. And so you can also watch some of the earlier videos we've released at our social media platforms and even our website. So visit www.LeishTonAcademy.com. You can also view some of our videos at our YouTube channel. Our YouTube channel, LeishTon Academy, social media network, LinkedIn at LeishTonAcademy.com, in Facebook at LeishTon Academy, Instagram at LeishTon Academy, LinkedIn at LeishTon Academy. And thank you very much for your time, and stay blessed and keep safe. Thank you.